Hi guys, I just wanted to let you know that I'm going to insert some pictures, but there's no blood. Are you ready to embark on a subject that might be scary or uncomfortable for you? It was for me, and I didn't find anything on YouTube or social media that was a personal experience that could be shared to tell me what someone had gone through for a tongue biopsy. So let's first talk about what a biopsy is. I'm going to refer to my notes and read exactly what a biopsy is according to Mount Sinai Health Library description. A tongue biopsy is a minor surgery that's done to remove a small piece of the tongue. The tissue is then examined under a microscope. So when you're done with your procedure, you're going to wait however many days, 4 days, 7 days, 10 days, and then you'll get a pathology report, and your provider will go over that report with you. So in my case, quite a while ago, I had a sore on the back side of my tongue. It didn't go away. In fact, over the weeks it got worse, got bigger, got more painful. So I went to my dentist. My dentist then sent me to an oral surgeon. So I had a consultation with an oral surgeon. But the time between the consultation appointment and getting the tongue biopsy, I waited, and I'm here to just try to give you support and encouragement that we all know the best thing for our health when we need to get a procedure done or get a lab draw done or get a biopsy done. That the sooner you get things done, the better, because sometimes time is critical. And besides that, why do we sit and wait and anxious, sleepless nights worrying about it? Well, that was me. So I scoured the internet. All I could find was terrible stories about tongue cancer, oral cancer, that sort of thing. So I already was just scared to death. So I continued to look, and I found a young lady who had had a tongue biopsy. She was on YouTube, and her channel was about purses and beauty, but this was just something that she had done. So she talked about it. She talked real. It was painful. She was scared too, but she got it done. And somehow that just encouraged me that somebody did it. Here's what I kind of can expect. I've got to get through this. I've just got to do it. So I made the appointment. I saw my oral surgeon. The time of the consultation, he said, we're going to do a biopsy today. Is that okay? Yes, great. What to expect? Okay, so his assistant is going to be there, or assistants. So they're going to help to hold your tongue, move it in the proper position. They also might take a biopsy of your palate, of the roof of your mouth, under soft, gum tissue. There are also oral biopsies that have to do with the throat. But I am just going to focus on the tongue because that's what I had done. So he removed that entire spot, and I got 4 stitches. You do get injections into your tongue, just like you do anywhere else, to numb that tissue. Tissue gets numb, tongue gets numb. He cuts it out, takes that piece out. Then I had 4 stitches. When I got back to my car, I wanted to talk to my sister because she knew that I had gotten this done, and she works in the dental industry. The problem was I had to text her because I already couldn't talk from the swelling, from the pain, from the numbness. My experience is that over the next 5 days, my tongue swelled more and more and more each day. And the pain was worse. My oral surgeon said, everybody does fine with Tylenol, just take Tylenol or take ibuprofen. But that wasn't touching it for me. And so I had it done on a Thursday, Friday, Saturday. By the time Saturday came, that was the most swelling I had, my whole tongue swollen. And if you swallow, you'll pay attention and notice that your tongue goes to the roof of the mouth. But every time you're talking and every time you're swallowing, your tongue is moving. So if you've got a spot there that really hurts, you're going to keep creating friction. So that's what I did, and I felt like such a wimp. Okay, why do we do that to ourselves? I felt like I couldn't call and say Tylenol doesn't work for me, so I just stuck it out until I saw him the following week. I went back to him for my follow-up. And I told him it really hurt. I don't know that I feel like you prepared me for how painful this was going to be. I think people need to know that it might be fine and they might do just fine, or they might have a lot of swelling and they might be in a lot of pain. He again reiterated that people usually do fine with Tylenol, and he didn't know why I didn't do fine with Tylenol. Okay, so I go back to my dentist a couple months later, and we also go over the pathology report, and I tell him about the pain and swelling. He says, you should have come to me. I'm your dentist. You shouldn't be in that kind of pain for 5 days. There's things we could do, even if we just give you a couple better pain relieving medications for a day or two. My pathology report. So let's talk about that. I live in Washington State. The biopsy went off to the University of Washington pathology. It came back with chronic inflammation. The inflammation has been from chronically biting, irritating, changing the cells a little bit. They're changing, I shouldn't say changing the cells. It wasn't cancer, it was inflammation. So I don't have that issue anymore because he literally took that whole section out. So I don't catch it or bite on it, or it doesn't bother me anymore. But I was really afraid. I was really scared that I had oral cancer. And so the bottom line here is that if you have something that you're putting off that you know you need to do, be brave, talk to somebody, connect here. That's what this is about. We're here for you. You'll get through it. But we all know, putting it off day after day, week after week is not the best thing for your health. And it just causes more anxiety for you to deal with than on a daily basis. So if you've had a tongue biopsy, please connect. Please let's talk about it. This isn't something that everybody gets every day. I don't know a single person who's had a tongue biopsy or stitches in their tongue from a biopsy. Maybe from trauma and certainly from piercings. And I don't know how some people get piercings done because some swell a lot and bleed a lot and others don't. But it's uncomfortable. It's painful. That's the reality. But I'm glad I got it done. Got to get it done. Got to go push through that fear to get to the other side and get your results.